Joining us now is WHO Director Dr. Peter Salama. Dr. Salama, thank you for joining us today. I want to begin with the evidence that you have gathered here. How did you make this conclusion that chemical weapons were used in this attack?
So really, at WHO, we're very focused on really the patients that we're seeing after this potential use of toxic chemicals. And what we've seen is between 50 and 100 dead. We've seen several hundred, more than 300 injured. And we've seen that these patients have symptoms that are consistent with the use of chemical agents. So really at the moment we're 100% focused on actually treating these patients with our partners, ensuring that we remove people from exposures, decontaminate, ensure that they're referred to appropriate hospitals and clinics, and that those clinicians have the up-to-date knowledge as to how to treat these patients and also the supplies and equipment to do so safely.
You mentioned symptoms. What type of symptoms have you observed on the ground?
So particularly we're seeing reports from our clinical partners demonstrating that the patients have breathing problems. It starts with runny nose, runny eyes, itchy eyes, then develops further into breathing problems, gastrointestinal problems such as nausea and vomiting, and then progresses from there into a range of symptoms, including muscle spasms, convulsions, and ultimately a number of patients have become comatose, and of course many have died, including up to 20 children.
Chemical weapons is an umbrella term. I'm wondering if you've been able to determine what type of chemical weapons may have been used in this case.
So the role of WHO as the World Health Organization is not to confirm or otherwise the use of chemical weapons or what type of weapons have been used. Our role really is to support the doctors and the partners on the ground who are really trying to address the patients, who are trying to alleviate the suffering of civilians. We certainly have seen, though, that this would not be the first time that chemical agents, toxic chemicals, have been used in both Syria and Iraq. We had reports of chlorine, for example, being used in and around Aleppo late last year. And of course, we've had other attacks, including the major attack using chemical agents in Ghouta in 2013.
Of course, the Syrian war has been going on for many years now. How equipped are hospitals in Idlib province to actually deal with the effects of this attack?
Well, it really is a major issue. WHO has been working with partners since 2014 to train clinicians on what to do in the event of the use of toxic chemicals. We've trained more than 500 clinicians across Syria, including in the last year around 65 in northern Syria, including in Idlib. So many of the doctors and nurses and health workers who are responding now have been trained by WHO and its partners to address this issue. But they need more than training, they need supplies, and we've been supporting supplies of critical medicines and critical equipment, such as protective equipment for the health workers, and also very specific antidotes in the case that we feel that there has been a specific agent used.
I wonder about your own personal reflections. Of course, chemical weapons have been banned by the Geneva Convention, and yet we're seeing it emerge in this civil war. What are your thoughts as to the use of this weapon in this latest incident?
I certainly believe that in the conflicts in Iraq and Syria in recent years, we've seen a tragic pattern of the incomplete disregard for international humanitarian law. And if confirmed, this would be another instance of that absolute flagrant disregard.
Dr. Salama, I want to thank you for your time.
Thank you so much.
And that's Dr. Peter Salama. He joined us. He is with the World Health Organization, speaking about the latest attack in Syria.